What's up, everybody? Just here on Periscope. Just wanted to share with you a couple of tips. Sorry, I'm a few minutes late, but you know how it always is when you go to do something live, the trash man comes around. So what I want you to do for me is, if you find this information great, you're going to double tap, give me some hearts. Apparently, that's the thing to do here on Periscope. What I want to talk about today is shoulder issues with your clients. So there's a couple things that you want to look at with your clients. If they are getting some kind of shoulder pain, they could have some type of impingement. But one other thing they could have is just, so many of us sit so much that it just could be posture. So what we want to do is take a look and see, are they actually staying up straight or are they rounded over? Because if they're rounded over, they're going to have issues trying to actually extend back, and it's not going to put the shoulder in the right spot. So when we go overhead, the shoulder's not going to sit in the socket as it should. And just imagine if you come up here and round over and put pressure down in your shoulder, that's going to cause a lot of pain. So the first thing we got to look at is actually getting your client nice and strong and being able to actually keep that posture so they can actually sit their shoulder joint in the right place when they go overhead. So that's the first thing you want to look at. So many people are sitting so much, doing a bit of thoracic extension. And thank you guys for all the little taps in the corner. If you have questions as well, you can throw them in there. But some other things they might have is they might have an impingement. Now, what I'm going to show you right now is just how to see whether or not there's going to be a positive sign that they may have an impingement. As personal trainers, we don't diagnose things, but we can definitely take a look and see if maybe something's present that we want to send people off to find out from a physical therapist, a chiropractor, whoever you deal with that their job is diagnosing things. But hello from Pacific Northwest, Jen. But what we want to take a look at is there's two real common ones. The first one is going to be subacromial impingement. So what you want to do with your client if you think they might have that pain. Now that pain typically happens, it's not near the bottom, it's not near the top, it's kind of somewhere in that middle range where they're going to get pain in their shoulder. How to check for it is this: how I cue it up is I tell them, pretend there's a $100 bill. Some clients that might not be enough motivation, but that's a whole nother story. So $100 bill on the shoulder, it's windy out. What you want to do is have them hold it down with their fingertips, right? They don't have to place their whole hand down, just the fingertips, and get them to raise their elbow up and see how far it goes. If it gets stuck before it gets past about 120 degrees, so if they get stuck before there, then that's showing that there may be a positive sign that they have a subacromial impingement, right? So if they kind of get here and they get stuck or there's any kind of pain, we want to refer them out. Now, what sometimes our clients will do, especially the ultra competitive ones, hello from Venezuela, is they'll try to find a way, because when we tell them what we're looking for is they're trying to lift their shoulder as high as they can. What they may do is they might actually protract their shoulder. So as they do it, they might be coming up, they get stuck, they might actually bring that shoulder, protract it, so they can get that extra range of motion. Now, obviously, that is not giving us the result we want to see. We want to see whether or not they kind of have that positive sign for impingement. So making sure that we watch that, especially your more athletic clients or people that are kind of ultra competitive, we want to watch that they don't do that. Now, something else we can do to see if maybe there's a little bit of impingement, maybe we can still work in that scapular plane, which is more kind of out on that 30-degree kind of angle. So we're not going to go straight here or straight here, but they might be okay in that angle kind of right here. Is we can look and see, instead of having the fingers here, we'll slide them over so that the hand is just kind of under the clavicle right here. And what we're going to do is just keep the finger and the thumb down, and we're just going to have them do the same thing. If they can get that range of motion without pain there, then we know that in that scapular plane, they're going to be okay. So those are kind of two things we can do, is look here, right? If they get stuck, we can bring them over here and see, can they still work in that plane of motion? If they can't, they still get pain, refer off. If they get pain even here, I'm still going to refer them off because I want to find out what's going on there. Now, what can't they do? Well, kind of anything where their arm's in this position here. They might be okay overhead, but definitely this is going to cause pain. But if someone has that positive sign for subacromial impingement, I'm going to kind of avoid a lot of those upper body movements, refer them out, find out what's really going on. Now, the second one is going to be the acromioclavicular, the AC joint impingement. Now that's where the pain typically takes place near the top of the movement. So that last maybe 10 to 15 degrees. And here comes the garbage truck again. So what we're going to do here, simply with your client, now you want to take the weight out of their hand. So, you know, this stretch here we typically do with people, right? We can stretch out here. You're going to do the same thing with your client, except you're going to take all the weight of their arm. You're going to push it across, so holding here, bring it across their body and find out, is there any pain in that shoulder when you come across there? If there is, then that's a positive sign that there may be an AC impingement. And again, that's where they're going to get pain at that top level, so that last maybe 10 to 15 degrees. So those are a couple of things you can look at. If they are not holding their posture, right? If they're kind of in that hunched over position, we want to teach them how to do all their lifts with proper posture. Now, if they're okay there, they're still getting pain, we want to take a look is where do they get the pain? If they get it kind of in that mid-range area, we want to look and see if they have a subacromial impingement. If it's more when they get their arm over top, they want to look, is it an AC impingement? So that is how you can take a look for your clients to see if there's any shoulder issues going on. Quick check, again, if they see a positive sign, that's when you're going to refer them off to someone that can actually say, yes, that is the issue. Then you can start to work around it. Thank you for tuning into the Periscope. If you want, you can share this with your friends. Let them know, you know, especially the trainers, because the more we can kind of share this information, the more we can get better, the more people we can actually help. Thank you for all the hearts, and I will see you on my next Periscope soon. Thank you, guys.